Hello, my name's Kate Owen. I'm Lead for Learning and Teaching at Warwick Medical School, and I'd like to talk to you about some of the work we've been doing to try and get the patient voice more into our case-based learning cases. The reason behind us doing this is largely to do with the change in direction of the GMC outcomes and the increasing and appropriate emphasis on patient voice. I'm also really interested in whether increasing patient voice in CBL cases can also help us teach our students professionalism and respect for patients. The way we've been doing this is we've been looking at Towle's ladder of engagement, as you can see here, which goes from no involvement from patients to partnership with patients. When we set up our new curriculum with our case-based learning cases, we started out from learning outcomes and built cases around them. Now, this may have included kind of elements from patients we had possibly seen, might have fed into the way we developed the cases, but there was no direct involvement from patients, and the steer was from learning objectives to cases. So we've been developing a portfolio of cases and trying to look at sitting them at different levels of this ladder. So we started off with a very low level of just showing our cases to patients and getting them to have a look at them and see whether they feel patients are represented in a positive and appropriate manner during the case. We've then introduced elements of patients with a similar condition to that in the case, with either some audio or some video content to run alongside the case. We then used simulated patients to interpret some elements of real patient stories and give a voice to it that way. And then we are looking at using a real patient story. But the thing we found that we'd really like to discuss at the conference is how we've kind of gone from learning outcomes leading to the case to actually where if we start making the case more authentic, it's harder to link it back to learning outcomes. And this is a tension that we're really trying to resolve.